So the naproxen, which is the big brother, it is a big brother of ibuprofen. Big brother of ibuprofen, right? It has a similar properties to that of ibuprofen. However, it differs slightly with compared to the ibuprofen that it has slightly higher risk to cause the gastric bleeding than the ibuprofen, right? So again, it will have a basic coverage. It will be a good analgesic, right? It will be a good mild to moderate, a little bit higher for the anti-inflammatory effect. It will again not that good, I would say, for fever. But why big brother? Because brother actually keep fighting, right? And because of that, you can have a bleeding. So as compared to the ibuprofen, naproxen will have a higher risk to cause the GI bleed, right? Now the naproxen, right? Naproxen has onset of action somewhere about 30 to 45 minutes. See, most of the drugs will have this range. Over here also 30 to 45 minutes. For the aspirin, right, it was somewhere about 30 minutes. The range may vary very slightly depending on the patient, right? Not all the patient will have like exact 30 minutes and the pain is gone. It doesn't work like that. There are several factors on which it will depend. So these are just an average estimated value. The peak action will be somewhere about 2 to 4 hours, and total duration of action will somewhere roughly around 8 to 12 hours, right? Somewhere it can even range up to like 17 hours also, right? So data may vary in different books, datas everywhere, right? And for the GI bleed, it will occur if it exceeds more than 750 milligrams per day. The risk will increase, right? And as the dose will keep on increasing, the risk also will keep on increasing simultaneously, right? So overall the GI bleed will occur somewhere about 70 milligrams, right? And total max dose will be somewhere about 1.2 grams per day. Okay, you can give up to 1.2. Yes, you will have a bleeding also, right? And at the same times you can even suspect some adverse effect of the naproxen that we have already discussed, right? So the naproxen was having higher cardiovascular toxicity, right? So whenever in comparison of the ibuprofen and the naproxen, we start with the ibuprofen, much more better handling of this drug by our body, right? So naproxen was much more cardiotoxic and ibuprofen was much more nephrotoxic. So which is a better? Yes, it's better to have a nephrotoxic than the cardiotoxic. Right. So we are done with the GI bleed and overall maximum dosage of the drug. Right. Now, let's talk about dose a little bit more. So dose of naproxen varies, right? It varies somewhere about like 250 to about 500 milligrams, right? And you can, because the max dose is somewhere about 1.2 gram per day, so you can give like every 8 to 12 hours before you hit this 1.2 gram per day threshold, right? We'll not talk about the naproxen composition and other drugs, right? It's not that much important because we discussed it for ibuprofen because it was much more important, right? The naproxen is not that commonly used as compared to the ibuprofen because the toxicity and the GI bleed level is so high. See, the range is so narrow as compared to that of the ibuprofen, where it was somewhere about 2.5 gram per day, right? So we'll focus more on those drugs which are much more commonly used. So the naproxen, again, if we talk about the indication, right? And for the indication, again, all those scenarios in which there is inflammation and pain. Yeah, most commonly for the pain, right? Because for the inflammation, it is somewhere about like mild to moderate to slightly higher edge, depending on the patient again, but it has a good analgesic effect. And also, second thing is that ibuprofen was acting for about 4 to 6 hours, right? And for the naproxen, it is somewhere about 8 to 12 to about 17 hours, right? So overall duration of action increases just for the same dosage, right? So yeah, the naproxen is that's how is a big brother, right? As we say of ibuprofen. Big brother always help and always fight, right? So always help. So if it is a helpful one, so the duration of action will be increased in this case. So let's talk about the indication. For the indication, again, similar indication, arthritis, right? Also you can use it for dysmenorrhea and musculoskeletal pain. I'll not say headache in this case because we have other much better drugs which we can use to handle such pain, right? And because the spectrum is kind of narrow, right, in this case for the GI bleed, right? So we have to choose that particular PPI, right, which will have a longer duration of action so that it can uh, be helpful for us, right, at the whole time whenever the naproxen will cause the harm to our stomach. At that time this particular PPI will help us, and in this case we can use esomeprazole, right? So this can be given alongside with the naproxen. So naproxen and esomeprazole. Always remember whenever I prescribe someone naproxen. Again, I don't need to remind you that single dose won't help you, won't be that disastrous. But if you're giving a high dose for a longer duration of time, remember to add esomeprazole along with it. So this was all about the naproxen, right? We have already discussed that for the side effect, it was much more of a cardiotoxic, right? But still, ibuprofen and the naproxen, these are two brothers in which I consider ibuprofen as much better brother than the naproxen. Naproxen is a big brother and only kills and destroys stuff. Okay, not in that way, but anyways. So it causes the gastric bleeding to the stomach, right? For the ibuprofen, better tolerability and much better antibiotic and the anti-inflammatory action than the naproxen. The only thing is that the naproxen, the duration of action is overall longer than the ibuprofen. Ibuprofen, somewhere about 4 to 6 hours. The naproxen, duration of action, about 8 to 12 hours, right? So single dose can help you sustain uh, the action of like analgesia, slightly anti-inflammatory property, slightly antibiotic property. But overall, again, go with the ibuprofen than the naproxen, right? Why to have a higher risk to cause the GI bleed, right? So this was all about the naproxen. Next we'll talk about the mefenamic acid, right?